second semester and why I've been MIA on here for the last 3 weeks, okay? You guys, second semester is going, okay? Second semester is not bad. It's really not bad. I just personally feel like there's a lot more weight on my studies and on what I'm learning this semester. I don't know if that makes sense, but I'm going to explain it to you. So I'm in med-surg, pharm, ethics, and IT. So my 2 core classes this semester are med-surg and pharm, both extremely important. In med-surg, you're literally going over every single type of patient that you can imagine, and you're learning how to treat your patient, how to educate your patient, nursing interventions, all of that stuff. So I just personally feel like there's a lot more pressure on me this semester because I really need to learn this information. Like, this is the foundation of nursing, and I want to make sure that I'm doing what I need to do to actually learn the material and not just memorize it. So I've just been feeling a lot more pressure and weight this semester in a good way. Like, it's not a bad thing. I just haven't had time to get on here and be fun with you guys. So that's why I've been at MIA. Pharm is going really good. We have our first exam this upcoming week, and I'm really nervous and excited to see how that will go. We did have our first quiz for pharm, and I scored a 92, but I do feel like that was a little bit easier for that professor. Usually her exams and quizzes are a lot more difficult. So we're going to see on Wednesday how that goes. Very first day of my med-surg class, the professor that had been teaching that class forever was like, effective today, I'm retiring and I will be part-time. So here's your new professor. And yeah, it was like, awesome. This is amazing, because you think, okay, who's going to write the exams? Who's creating the PowerPoints? You know, like, what? There was a lot of back and forth and a lot of confusion the first 2 weeks. And because of that, our quiz went horribly. I got a 56 on my first med-surg quiz. The highest in the class was a 60. And I was like, wow, if it goes like this the rest of the semester, I'm cooked, chat. I'm literally cooked. But we did have our first exam last week, and I got an 88. I got an 86, but then she gave us a point back, so 2 points back. So I got an 88 on my first med-surg exam, which I will take. I will freaking take that, okay? Our next quiz is in 2 weeks, so we'll see how this goes. I do really like my new professor. She is like no BS, straight to the point. She challenges you. She asks you critical thinking questions. Sometimes it's a little humiliating because you don't really know a lot, you know, like, you're a baby student. Like, we're just now getting into the meat and potatoes of nursing school. So definitely I feel like it's just a lot, you know, and I really want to learn as much as I can this semester. Even more so because when I'm on clinicals, we're so much more hands-on, you know, we're pulling meds, passing meds, the whole shebang, like wound care, trach care, like all of that. So I just really feel like the last few weeks I've been just trying to wrap my head around everything that I've been learning and just to like get into my groove of things. So that's why I haven't been on here, you guys. In terms of clinicals, my clinicals are going great. I am at a long-term progressive care hospital. So all of our patients are in pretty poor condition. They're either trached, they either have severe wounds, sepsis, they're on hemodialysis. Like, I mean, it's the patients at this hospital are not in good condition, and either they're going to rehab or they're going to hospice, or we're going to do end of life or comfort care for them. So there's a lot of weight too at clinicals. You know, I'm seeing a lot of stuff for the first time that I've never seen before, and just types of situations that I've never done before. Holding patients' hands when you know that they're in pain. Like, for me, I don't take that lightly. Some people, they can just turn off their emotions and be good. I'm not that type of person. I'm an emotional person. I like to connect with my patients. I really love what I'm learning and what I'm going to be doing as a nurse. So I do take that stuff to heart. And I don't ever really want to get jaded. I think a lot of the time healthcare professionals do get jaded over time because you see a lot of horrible things, you know, and I'm sure naturally in my career as a nurse, I will feel that type of way, but I hope that I can always find myself back, you know, in like a baby student nurse Ash, and caring and having that piece of my heart always open for my patients. So clinicals are doing good. I do have a student nurse interview I did apply to the PCU at a local hospital near me because I really do want to get hands-on experience while I'm in school. You can learn textbook material all you want, but nothing compares to the things that you learn when you're bedside with your patient. I have learned so much stuff, and it definitely helps correlating what I'm learning in school to what I'm doing with my patient, and I love that. So I really hope that my interview goes well, and I hope that I get it because I do want to pick up like one shift a week. It's PRN, so if I did one shift a week, it's 12 hours of bedside care that I'm learning more and applying my knowledge and also getting my foot in the door with a hospital near me. So we will see how that goes. But yeah, you guys, I'm so sorry I've been MIA. I love getting on here and connecting with you guys. It's just been hard the last few weeks, before anything, like my school comes first, and then on top of that, just trying to navigate like mom and my schedule with my girls and just my personal life and just things like that, so I will try and be back on here more consistently. I am okay. I want to know how you guys are doing. Okay, if you're in second semester, please let me know how your second semester is going. Like, I don't know if it's just me that feels this way, but let me know what's going on with you guys. Let me know how your quizzes and exams are going. Comment or DM or whatever you want, but I love you guys, and I hope you're doing great. Okay, talk soon. Bye.